Swine flu and seasonal flu. It's on the minds of many of us, wondering about the vaccines and the upcoming flu season. Later this morning, disease experts from numerous health organizations will hold a news conference to address those concerns. And joining us now from Washington, D.C. this morning is Assistant Surgeon General Rear Admiral Raschuchat, who is with the CDC, and Dr. William Schaffner, incoming President-elect of the National Foundation for Infectious Diseases. Good morning. Thanks so much for being with us. My first question is, are you making any new recommendations about the flu this morning?
Our key recommendation this morning is that it's time to get the flu vaccine. The regular seasonal flu vaccine is available already in your community, and it's time to get it to protect yourself and those you care about and those you care for if you're a healthcare provider. Vaccination is the best way to protect yourself against influenza and its complications.
And of course the H1N1 vaccine is not available yet, but let me go back to the regular vaccine right now. We hear a lot of people say, gee, it makes me nervous, I don't want to take it. You believe it is safe and people should go ahead and get the original flu vaccine.
Mike, we know that the influenza vaccine is safe. Last year we gave about 90 million doses, and we give about that much each year. It's just about the safest vaccine that we have available. There's a myth out there, that you can get flu from the flu vaccine. That's just nonsense. You can put that aside. Both the nasal spray variety and the injectable variety are safe and effective. We should all go out and take advantage of it now, protect ourselves and our families and the people whom we love.
I know that at my son's high school there are a lot of kids that have been sick with the flu. Has it started earlier this year, and do you think we're going to see some sort of pandemic?
We are seeing flu early this year. We saw this new strain H1N1 come out last spring, and it never went away this summer. And as kids have returned to school or college, we're seeing increases in some parts of the country. We think it's going to be a busy and long flu season with the regular flu strains and this H1N1 on top of it. And that's why it's so important for all of us to take steps to protect ourselves and our families. First, by getting the seasonal flu vaccine, and then in about a month, for those for whom it's recommended, getting the H1N1 vaccine. Lots to do to keep ourselves healthy and safe this year, and vaccination's the best way to do that.
Can you update us on that H1N1 flu vaccine? Or I know we've been hearing October 15th or so when it will be ready. Any updates on that?
Well, the clinical trials are underway. The results will be in fairly shortly, and we'll hear all of the recommendations and when vaccine will be available around the country. We still anticipate that will be around the middle of October. That's then. This is now. And now regular influenza vaccine is available. Remember, regular influenza kills 36,000 people each year, Mike, and puts some 200,000 people into the hospital. This is a serious illness. So it's recommended that all children aged 6 months through 18 years of age be vaccinated against regular influenza. Everyone age 50 and over. Those people between those two ages who have underlying illnesses such as diabetes, heart disease, lung disease, immunocompromise. Pregnant women should be vaccinated. And of course, we healthcare workers should also be vaccinated with the regular seasonal influenza vaccine. And we can all start doing it right now.
Very good. Well, Dr. Schaffner and Rear Admiral Raschuchat, thank you so much for visiting with us today from Washington, D.C.
Thank you.
Pleasure.